Hi everyone. This is my video blog for this week. After completing the leadership skills questionnaire, I found I scored high in the high range for all three components of the questionnaire, with interdisciplinary or interpersonal skills being the highest score at 24. I received a 22 on administrative and a 21 on conceptual skills. So according to this questionnaire anyway, I am pretty well rounded. I feel like the things that I need to work on would probably come with just more experience. Acting as the charge nurse at the facility that I work at. I work at the Wilmington VA Healthcare Center. I already have experience calling on resources in order to cover staffing issues. At the Wilmington VA Center, we operate on a patient-aligned care team system. With each team consists of a provider, which is either a PA, an MD, or a nurse practitioner. We have an RN care manager, which is my role. We also have an LPN, and we have a medical support assistant, or an MSA. We are supposed to huddle on a daily basis to discuss patients who are coming in that day and any of the needs that they may have. So each person on the team has a role. The provider sees the patients, the LPN checks in the patients, and they complete the clinical reminders for each patient, which are screenings based on the patient's age and their comorbidities. For example, they screen for such things like whether they're due for their pneumonia vaccine, depression screenings, PTSD. We have a lot of that at the VA. HIV testing, hypertension management. There's all sorts of things. Foot exams if they're diabetic or if they have circulation issues, that kind of thing. These all pop up automatically in our system, but it's based on the patient's age and their comorbidity. So it's a really fabulous tool to have in primary care. The RN care manager, which is me, we see patients in our clinic also. We can see them for diabetic teaching, hypertension education. We also see them for acute conditions like if they've possible fractures or rashes, those types of things. If something comes up and they need to be seen real quick, we get them into our clinic. We triage them. If we need to pull in the provider, we can do that. The medical support assistant, their responsibility is to schedule patients in the provider's clinic and the RN's clinic. As a team, we also have HEDIS measures that we have to answer to monthly, which are usually above the recommended levels if we complete all of our clinical reminders. As the next level manager, as far as this goes, I would have to help the teams that struggle meeting their HEDIS measures every month and try to identify what they can do better to help perform at a higher level and get those clinical reminders completed, because it's usually something to do with the team that's somebody's not doing their part, basically is what it is. In the article I found, it was called The Casey Allied Health Model of Interdisciplinary Care, Development and Implementation from 2013. I'm going to read this quote from it. It showed a high level of agreement with existing literature that identifies excellence in interdisciplinary care. The model has generated positive outcomes for staff and positive benefits for patient care. I feel that the VA Healthcare Center, we already utilize this interdisciplinary approach to healthcare. We've been doing it for quite a while. At times we get away from it, like right now we do not have time for morning huddles, which I believe is necessary to communicate within the team and provide these ancillary services that veterans may need when they come in. So as the next level manager, in order to try and get those back, I think I would try to pull the patient data or pertinent data that shows the benefit of having these huddles, the benefit to the employees and to patient outcomes, so we could try and get those huddles back. When RNs and LPNs are out due to sick leave or vacation, as a charge nurse, we have to assign another member of the team, another RN or LPN to cover for them while they're out. I usually base my decision on a variety of things, such as the schedule of the provider. If the LPN needs to be replaced, then we need to know how many patients that other LPN is going to have to check in to add to their already busy schedule. I look at the skill level of the nurse who I'm going to pick to cover that team, because some just are faster than others and quicker at doing it and do a better job. And we look at the familiarity of the nurse with that provider's panel. If it's a nurse that's out, I usually can cover for the provider that sits right next door to my provider, because we tend to trade off a lot and cover each other's clinics when we're out. As a next level up manager, I would be the one to approve or disapprove these leaves that these nurses are requesting based on staffing for those days. Also, as a next level up manager, I would be in charge of hiring new staff members for the vacant or new positions as our facility grows. I have already participated in interview selection for both RNs and LPNs. Our interviews are performance-based interviews, which I think are very helpful. They give us an excellent idea of how those RNs or LPNs will fit into our organization. As a next level manager, I would have to learn budgeting constraints and how to manage those resources. This is not something that I typically deal with right now. But for instance, we have been growing in the last 2 years, and we've added 3 new PAC teams, primary care teams, to our facility. And we're lacking the equipment for the patient care rooms, for the patient exam rooms, sorry, such as blood pressure cuffs, for one thing. So finding the room and the budget to cover the cost of these blood pressure cuffs would be a challenge. Also, as a next level manager, I would have to coordinate care between the different pillars of care in our facility. Currently, the VA operates in somewhat of a silo type of structure. The nurses report to the chief of nursing, the providers report to chief of staff, and everyone else who works at our facility reports to the administrative officer. Communication between these different departments has not always been the best, but it is improving. The nurses actually asked to have a quarterly or monthly meeting with these other pillars, other management, so that we would have a better sense of communication between the different elements of our primary care teams, the providers, the nursing, and ancillary services, or the medical support staff. Seemed like we were getting mixed messages from each manager, so it's been very helpful. It has improved communication between these different departments. As a next level up manager, I would have to be able to communicate with these other managers of these other departments, the chief of staff or the administrative officer, and I feel like I would function pretty well in that role at this time. I get along very well with our chief of staff currently and the AO. They're very easy to talk to, and we all just have the same goal of providing the best patient care to our veterans. The VA has the following core values. It's called I-CARE. It stands for integrity, commitment, advocacy, respect, and excellence. Every decision we make, we try to keep these core values in mind. I feel that the VA's organizational chart is somewhat between the horizontal and the vertical type of structure. I wish it were a little less vertical and more horizontal, because sometimes I feel upper management is too far away from the day-to-day activities of daily patient care, and sometimes the decisions that they make or the changes that they make they've not taken into consideration how the actual process works in primary care and what our structure is and how we operate. But all in all, I think those are some of the ways that I would use the managerial skills necessary if I were the next level up manager. I feel like I work for a great company. We have some great ideas, and we're making improvements daily, which is fabulous for our veterans. it definitely helps to improve patient outcomes. Thank you so much. Have a good day.